All right, thank you so much for staying with us. Let's start off with the newspaper review. If you're just joining us, you're just in time for State of the Nation. Let me introduce my guest one more time. Honorable Dr. Otiende Amollo, Member of Parliament for Arieda. Honorable Dr. Kimani Wamatangi, Kiambu Senate and Majority Chief Whip. His Excellency Dr. Alfred Mutua, Machakos Governor, is here. And Honorable Samson Cherargei, Nandi Senator, is joining us online. It's a State of the Nation. We'd like to hear your views on everything that we're going to discuss here. It's all matters touching on the State of the Nation, as the name suggests. At Trevor Mbija at Citizen TV Kenya, use the hashtag Daybreak. Let's start off with the dailies. Raila is out of danger, says doctors. That's on the Daily Nation. On the Standard, what ails Raila is a question. Well, none of us here are doctors, but Honorable Otiende, I'll give you a chance to comment on this. Was it the grueling political activities that have somehow taken a toll? Because I know you're close to him, so you guys may have had a chat.
Thank you, Trevor. First of all, I wish Cherargei was here. You know, I keep saying that our brothers from Tanga, they have this morbid fear of appearing where the rest of our colleagues are. So they hide. I think Cherargei, the other time, said, I don't know he was where. So today, I'm sure he'll disclose where he is. Hold up somewhere. But anyway, welcome, my brother, Senator Cherargei. Having said that, it is not in my place to discuss what ails Raila Odinga, except to say that, yes, Raila Odinga was unwell, but he's not in any danger. And what is to be noted is that, unlike other leaders, whenever Raila is unwell, he takes the time and the team takes the time to brief Kenyans so that there's no anxiety. I mean, this is to be contrasted. You will see the dailies in terms of the level of anxiety that is now in our neighboring republic, Tanzania, about President Magufuli, who they cannot disclose anything about. And rumor is rife that might be within the precincts of this city. But even before that, I think as of last week I mentioned this, that there was a lot of rumor that there were a lot of leaders from our neighboring Tanzanian Republic who are actually at Nairobi Hospital. Yeah. I think the lesson in this is simply that as a leader, your health is not just your private business. It also concerns the Republic. And so if there's any issue of concern, you should update people because, you know, to avoid anxiety. All I can say is that Raila Odinga is not in any danger. Raila is safe and is recuperating. All right.
Senator Kimani Wamatangi. And I know this, we are not, Honorable Otiende is absolutely right. We're not supposed to posit about this because none of us here are doctors, but I'm just giving you a chance to give your quick recovery wishes on this.
Well, yeah, and of course the only way to talk about it is not to try and do a medical disposition on his condition. I mean, maybe just the general you know, thoughts and maybe even when you ask what ails him, yeah, you'd look at it not medically necessarily. But first, Trevor, good morning to you. We didn't say hi on air. And also, it's a good morning to our viewers. Yeah. It's been a whole 1 week before we last spoke. And Trevor, I think it's also fair, even as we wish the leader of the ODM party and handshake partner a quick recovery and back to his feet. To also note that, the kind of load that he carries is a heavy one. I mean, remember, he's been hot and active on the campaigns, BBI campaigns. Yeah. And remember, just last week when we were here, he was traversing the country. He was in the coastal region, yes. And before that, he had also done tours, including in Mount Kenya region and other places. Yeah. And for a politician, I would tell you, Trevor, it is normally a very, very grueling and tiresome exercise. Remember, then also, of course, there has also been the by-elections just a week ago in Western Kenya. And even if he was not there in person, yeah, he had candidates in those by-elections. And the pressure, psychological and otherwise, that kind of involvement also exerts on somebody is big. Yeah. So I think it would not be just out of the unexpected, for that matter, that he would not be suffering from you know, some kind of pressure.
Level of fatigue.
Yes,
right.
so we wish him well, and to get up quickly. He would be missed a lot if he was not active. I mean, you know, he spices politics and gets things to go about, and gives people things to talk about and think about.
Okay.
I mean, he's been described as an enigma.
Yeah.
Well, we wish him a quick recovery.
Okay. Dr. Mutua?
I think the most interesting thing about, our viewers, I think Dr. Matangi did all the salutations. So, habari asubuhi, pote mlipo. Raila is a very hardworking man. And I think to be a very good politician, you need to have the energy, transverse. But that comes with fatigue. And fatigue can be a killer. Fatigue is real. Fatigue is stressful. At times you can fall sick. And there's nothing basically chemically or biologically wrong with you. You're just fatigued, and stress is very, very bad. So I like the idea that the doctors have decided to keep him in hospital. Yeah. It is good to keep him in hospital, because if he gets out of hospital, he'll have people coming to see him at home. He'll have meetings. People will be calling him. Can we have a meeting? You know, he'll be forced to work. Yeah. But when in hospital, the doctor can say no visitors. Yeah. The doctor can say let him just watch movies. Let him catch up on some football matches or soap operas, or, you know, that he wants to watch. Yeah. But also is the fact that the whole issue of does Raila have COVID or does not have COVID? Yeah. You know, I think we need to, as a country, to move on to a place where it is okay to get COVID. And, you know, you look at the newspapers, they're all denying, well, he doesn't have COVID, we've done the test. So what if he gets COVID? You know, he's a Kenyan. Yeah. Many Kenyans have gotten COVID. I mean, many senior government officials have gotten COVID. Many Kenyans have gotten COVID. So for me, it's not a matter of here and there. So if Raila turns out to be positive with COVID, that's okay. Then he's treated and gets back on the road, which shows us that, you know, anybody can get COVID. Yeah. So what I did not like was this thing of, oh no, he doesn't have COVID, the family are laying COVID-19 fears. You know, let's not make COVID-19 look like it's a disease that is a pariah, that is a problem if you get it. Anybody can get it from anywhere. Okay. You know, it can be floating in the air, in your car, anywhere you can get it. Okay. You know, you prevent yourself, but let's not send the message that, no, he doesn't, no, it's, let's say, be hush-hush. If he has COVID, let him get COVID. If he has COVID, let him be treated for COVID, he gets out of it, and life moves on. Okay. As, sorry, to finish is, like the case of, you know, the issue of the president of Tanzania. Is he in Kenya? Is he not in Kenya? Does he have COVID? Does he not have COVID? Yeah. Is he in India? You know, all these mysteries. It's as if getting COVID is like going to hell. It causes an anxiety. Yes. Cherargei?
Thank you, Trevor, and good morning, Kenyans and my colleagues in the studio. And I want to assure the Rarieda MP that I am, the last time he checked, he realized later I was being harassed by the police later in the day. So some of us are always on the ground, making sure that the wheelbarrow moves around. Number two, I want to wish the former Prime Minister quick recovery. I agree with my colleagues that it is not in our place to discuss this, what the doctors have already told us. We wish him a quick recovery. We hope to see him as soon as practicably possible. With the ongoing the politics of the day, and we hope that the family and the doctors and the ODM as a party will keep the country informed on what is really happening with him. And I agree with my colleagues that when you are a leader, you are a public servant, it is very important to share with the public your health status, especially when you are sick. And I think the public have a right to know. So we have, so far so good. We have seen a lot of information being issued by doctors and family members. And we hope that the former Prime Minister will be up on his feet and be able to continue participating in the BBI campaign rallies and the reggae and everything that is, although of course is best known way. But it is very important. But I hope Otiende Amollo will continue, and his ODM party will continue to keep Kenyans up to date. Finally, Trevor, is that Of course, we wouldn't want to see the anxiety that we are seeing in Tanzania, where their president is not known where he is or whether he's sick or not. But I think every Kenyan and every individual, every citizen from every country should know if their leader is sick, and I think that is very important. But we wish the former Prime Minister all the best and quick recovery, and hope to see him around again.
Okay. Speaking of medical issues, and let's talk about this, Dr. Otiende. You know, now there's a third wave of COVID-19, and Dr. Alfred Mutua alluded to this, that we shouldn't make it seem like it's a disease that is almost foreign, that if you have it, there's something wrong. Mutahi Kagwe is now saying that there is a third wave coming in. Governors now want political rallies banned as COVID cases increase. In fact, that's still on the front page of the Daily Nation. They're saying county chiefs call for a 30-day ban on political gatherings, even as Health Ministry gives the strongest indication of a return of tough measures to curb coronavirus spread. So there are two things there. Is this going to help in any way, banning those political gatherings? And then there's also the issue of continuing with the strict measures that are in the country right now.
Well, I think, Trevor, even as we go there, let's start from what you showed there. I mean, the KEMSA probe in the National Assembly by PIC. I think it's a theater of the absurd. It's 1 year on, and we are being treated to a theater, which is all we can do in the National Assembly, and allowed the PIC, because they can't do more than that for now until the report is out. But the truth is, the agencies that are concerned are asleep. And the truth is, this KEMSA probe is just a fraud. Because if the DCI, if EACC or any concerned agency wanted to deal with this, all the things that are now coming out, they'd have learned 9 months, 10 months ago. And right now we'd have had people who are prosecuted. So this is just a charade, and I think it's really sad, and it's symptomatic of what ails us as a country. Having said that, I agree with the Council of Governors that you know, the measures that we've had in place in respect of COVID should actually be sustained. Governor Mutua is here. But the truth is, when governors said that political gatherings should be banned, you know, they're not being genuine. Because we as politicians are the culprits in this. And whether the government, you know, it's not a question of saying the political gatherings should be banned. They were banned. The measures in place for the last 1 year require that there should not be a gathering of more than 100. But we've still been gathering. So what the governors should be saying, what we politicians should be saying, that moving forward, we are going to make sure that we do not encourage political gatherings. The truth is, that's very difficult. And I dare you, next week we'll talk about this, the week after this, the political gatherings will continue because we are nearing, first we are nearing the vote for the referendum. Secondly, we are nearing the 2022 elections. What we should urge, because I saw this just the other day when I was in Matungu, and I tried to encourage my own constituents. The truth is, outside of Nairobi, people are no longer wearing masks. They treat COVID like a foreign thing. We should emphasize those measures, and I urge the president to sustain them, but individually, especially as politicians, we should encourage people to continue wearing masks. Let me take the opportunity to talk about 2 more things. One is the COVID vaccines. First, I think, as I said here, that I think the government is doing quite well in terms of the COVID vaccines, because the president moved swiftly you know, to distribute the vaccines that we received. A lot of the counties have moved swiftly, you know, to make sure that those who are in the essential services get vaccinated. The only thing, though, is the government so far has only focused on public health institutions. And the truth is, that is a good thing. But the private health institutions are actually handling more COVID cases than even the public health institutions, especially of the leadership. So I think the government should ensure that they also get it. The second thing I want to speak to is to congratulate my Archbishop Anyolo, and basically the Catholic archbishops. You know, I'm Catholic myself, and in the Catholicism we have a lot of formations. We even have lawyers, who are Catholics, doctors who are Catholics, and sometimes they speak independently.
Yeah.
There was this formation of doctors in Catholicism who really were trying to spread fear among Kenyans. And I'm glad the Catholic bishops came to, to speak to that and say that is not the voice of the Catholic Church.
Yeah.
I think we need more vaccines. Let us avoid the propaganda around vaccines and let us prioritize.
Yeah.
When it comes to our turn, we will also get vaccinated if that is what it will take to encourage Kenyans to be vaccinated.
All right. Dr. Matangi, Otiende has spoken about 3 different topics at the same time. I just wanted us to stay with this issue of political gatherings, then we'll go to the KEMSA issue for a bit. But I find it a bit strange that Dr. Otiende says that they know that there's a ban in political gatherings, but they will still continue. Isn't that the sort of impunity that you politicians are treating Kenyans to? Saying one thing on the one side of the mouth and another thing on the ground?
Well, unfortunately, Trevor, not only actually politicians. I agree that politicians have been the worst of the lot. And if you look at how, since COVID struck the world, and especially our country, Kenya, there is no one time when you ever saw political leaders exercising or even showing Kenyans in their actions that they take COVID seriously. Right from the word go. It's not that just that something that's just started. I mean, remember for all those days when you had, not even before the campaigns for the BBI, you find that these ones want to oppose, so they go and call a meeting. Even during that time, meetings of politicians themselves. You find somebody they were holding meetings in homes and other places, bringing in supporters. It is actually a tragedy. And you know, Trevor, one thing that we must tell Kenyans very clearly is that the solution in combating and winning the battle against COVID is not the vaccine. The vaccine is very important. But if you look at the story of other countries that have succeeded in fighting and containing COVID, it is because of sustained discipline. Yeah. Sustained discipline. Because even when we are getting vaccinated, we are also being told clearly that this vaccine does not mean that you stop wearing masks, that you stop social distancing and other things. Yeah. So that means it is, you know, I traveled the other day on some official business to some countries outside this country. You can't believe what you see when you go out there. It is everywhere. Yeah. Wherever you go, the procedures are the same. You arrive at the airport, there's testing, you move out before you get a cab, then before you get into the hotel, there's testing. Well, before you get into a taxi, they tell you how to sit, what to do. Yeah. You can't be served in a supermarket if you don't have a mask. You can't actually enter. Even a hotel to go and take a cup of tea. It is written clearly out there, no mask, no service. I mean, so that is how these people are winning the battle against COVID. For us, as they've said, and sometimes you ask yourself, do you really want to blame Kenyans? Do you really want to blame Kenyans for the attitude that they're having right now? I mean, if you go up country and you find people are not wearing masks, do you have the moral authority to stand and say they're not wearing masks? Knowing what you're doing, because you're saying that, observing them, you know, as you pass the market on your way to a political rally that you have called yourself. And I'm not talking about Otiende Amollo. But I've also seen Otiende Amollo addressing gatherings the other day on social media in I think in a wedding that was crowded. Anyway, I'm not saying maybe he may not be the one who had called it, but that is what all of us politicians are doing. So then you find that when it comes to debate time in the National Assembly or in the Senate, this is the story we are saying. Even here, we are very bad. We are not, Kenyans are not doing things. Which other Kenyans? We are the Kenyans who should stand in front and then show people what to do. So I'm in perfect agreement that the first people who have violated the code, the people who have shown what should not be done as what should be done, is political leaders. And so, Trevor, I think if we are going to have to apportion blame and ask people to take responsibility, specifically on the issue of how people are behaving right now, it's political leaders. But let me finalize by saying this, that I think we also need to rethink from the top at policy level how are we going to cascade downwards to ensure that even now as we look at priorities that are going to be funded, and it is unfortunate because if you look at what's been airing in the last 1 week on TV, largely it is about how funds were abused during the KEMSA,
we'll get to KEMSA
and so on. Yeah, you've said that, but how I want to allude to it is this, that should not be used as a way to dissuade or to take away the focus that we need to invest and fund activities that are going to contain COVID, including at county government levels. There could have been pilfering in the earlier days when this was announced. But that does not mean that government should not come down with clear policy, clear funding, a set amount that says that this amount goes to this institution, and to county governments, specifically to fight COVID.
Okay. Dr. Mutua, you know, governors now want political rallies banned, but they were already banned. So what is going to be so different now?
You know, when it comes to talking about enforcement, I've listened to my colleagues here talking, and it strikes me that the challenge we have in this country is adherence to the law and impunity. A country like Australia, for example, where I have interests, when they announced a form of a lockdown, even the police went on lockdown because everybody went on lockdown. The police did not have to police anybody. Your own kids will not allow you to walk outside. They'll tell you, no, daddy, mommy, stay home. The government has said stay home. So there was no whipping of people, beating people up as the police were doing for you to agree that there's a curfew. Other countries, they have reached a state of what you can call even evolution in their minds, that they believe in the law because the law is taken seriously. Here, there is that sense of impunity from the KEMSA to everything, the jokes that we are seeing here. I ask myself, okay, so we governors are saying, let's have 30 days of no political meetings so that we send the right message. But then we see that bars are the main spreaders internationally, followed by gyms, followed by religious centers, churches and mosques, followed now by political rallies or gatherings of big people in weddings and others. And we've had very stringent regulations that have been set, but are we obeying them? But then the question becomes, so what if a politician decides to go against what has been said to be done? What will be done? What will Uhuru do? So Uhuru Kenyatta, our president, beloved president, will stand up and say, no political rallies, ndugu zangu, no more people. He'll do that announcement. So if Ruto now, after that, goes to Kayole and holds a political rally, Mutua goes to Kirinyaga, holds a political rally, Raila goes to, what will Uhuru do? Will Uhuru get me arrested? Will Uhuru say Ruto be arrested? Will he say Raila be locked up because you've gone against the law? Will he really do that?
But isn't that where the problem is, the level of arrogance that you politicians have?
It's not just the arrogance, it's because there is no, what do you call it? There's no punishment that will face you. Because we know, and Dr. Matangi has clearly said, people are meeting in homes. People are meeting in offices. You know, people are gathering. You know, you don't go out, so bring them in. And it is in contravention of the regulations. What was done to them? Nothing. So, you know, this is impunity that has been bred because of government inaction. And so, because nothing will happen to Ruto, if today he wakes up and goes to Eldoret and holds a massive rally in public, mutadu, will you ask Ruto to write a statement, hold him to jail, lock him up over the weekend, he shows up on Monday, he's given bail? You know what I mean? Will Raila be done the same? Will Mutua and Wamatangi be driven? No. And you see, therein lies the problem, is that this law is not really enforceable. So if the president is serious and he wants to end impunity in this country, he just needs to wake up one day and say, okay, it doesn't matter who you are, whether it's my son, myself, whether it is a governor, whether it is my deputy president, if you do not adhere to these rules, I order the DCI to get their work done together and get there. The last thing is also because people don't care about adhering to these regulations, because even if you get arrested, you get bail, and then in case it is accused of 2025. itaisha 2027. You know, the cases never end in this country. You know, our landed friend here knows, you know, you take a plea today, then unaambiwa kujeni in August, msikize mention. One lawyer is sick, the guy could not make it, so kujeni December. Yeah. So the case never ends. So we're in a country whereby really, if we had a proper legal system that enforced from the policing area to the judiciary system, and there was speed, you know, chap movement in terms of getting our laws adhered to, would be in a better place. Okay. And finally, we can talk about the vaccine, or we'll talk about that?
No, we'll talk about that in just a bit. I want to hear Cherargei's view on this banning of political rallies. Will this help in any way, Cherargei?
Thank you, Trevor. I think the issues of containment that should be in place, I think we have to applaud the government since, I think, early last year, March, when the first case was reported in the country. The government did put in containment measures. And I think if you see the difference between Kenya and Tanzania is because our government did take decisive action. I think the challenge has been whether Kenyans agree with containment measures. The issue of banning political rallies is still a big challenge. But I want to believe that even as the president is supposed to communicate tomorrow on further containment measures, because we are being told there's a third wave of COVID in the country, the biggest question is that I heard yesterday that 2 million Kenyans have been condemned to poverty because many sectors like tourism, other sectors, the economy is not doing very well. So the big question is, should you increase more restrictive measures, yet Kenyans cannot hustle, cannot move around, cannot hustle for their daily bread? So what happens? Should Kenyans be restricted from moving? They can't hustle to look for their daily food, or what should you do? And I think the big question is that we agree COVID is real, is a pandemic, that all of us have collective responsibility. But what happens to Kenyans that need to move around so that they can look for their daily bread? I think I agree that political rallies are being banned, but it is shocking that the people who want political rallies is being banned are the same people who need those rallies, because we are being told there is a BPI process that Kenyans need to be popularized across the country for referendum and what have you. So, and we have been told by our friends, the proponents of BPI, that they need to move very fast, say that by June or May there should be a referendum. So it is a catch-22 situation that the president and the government should look at. And I think it is a big challenge, but we hope that the restrictive measures will assist the country to also contain the third wave. And finally, I've had Dr. Mutua talking about cases delaying. For us, when I had a privilege of serving as the chair, what we see is much more than what people see, because judiciary is being underfunded. They don't have enough human resources. The courts are not sufficient in the country. And, you know, Kenyans are very litigious. So I think also we should not condemn judiciary, not knowing that the challenges they are facing, so that they can expeditiously listen to our cases. Okay. So I think that that's the right, that we need more containment measures, but also the president should be sensitive to the need for Kenyans to hustle for their daily bread.
Okay. Dr. Otiende, you know the president speaks tomorrow. Now, where does he draw the line and the balance between livelihoods and containing the disease? Because we've seen the impact that all these containment measures have had, and especially on people's pockets. And now the vaccine is here, but also it's not enough for everyone.
I am not in any doubt, Trevor, that given the numbers we are looking at with this third wave, I think the president should continue all the measures that so far the government has taken, including the curfew. In fact, the danger is the government might want to enhance it. But I would suggest that we do not enhance any of the measures. I would suggest that we sustain them. When Senator Cherargei speaks to where do we draw the line between the hustling, and I think he means the struggling Kenyans, because we've spoken to this before. Hustle is a very negative word. I would not use it on behalf of Kenyans, except those in the Tanga wing who choose to do that. You know, there can be nothing more important than life. Even to struggle for livelihood, you must be alive first. So when we are faced with the danger of many more people dying, we must take measures that ensure as many Kenyans as possible are alive. But I agree with him, and I love the Kenyan government so far, because right from the word go, we were caught in a very interesting situation. We had neighbors who took really stringent measures, almost to the point of outrage, to stop everything. But then we also had neighbors who were in denial of the existence of COVID. And I think Kenya walked that narrow path of accepting that there's COVID, taking the necessary measures, but not extreme measures. And I think that is the land to sustain.
Okay. Ometangi?
Trevor, I think personally that, yes, the president has the responsibility tomorrow to get out and show the country the direction. And indeed, at this time, what he would do, given the timelines that are there, is probably propose measures that will still continue to contain the outbreak. But I say this, Trevor, that I think as a country now, we cannot afford to be speaking from both sides of the mouth. By one acknowledging, and remember, we are talking about a virus that has struck us, and we have prior experience with how HIV/AIDS dealt with our population, the massive destruction of our economy, infrastructure, family infrastructure, and so on, and loss of lives. And so we cannot say that we are naive to the effects of that kind of pandemic after experiencing HIV. And then come down to what we've been saying now, that COVID will be and is the new normal. Now, the question you would want to pose to government is this, in total. So what are you doing about it? I mean, if it shows then that is how life is going to be in the future, what are we supposed to do? And people still have to put bread on their table. People have got to work.
Yeah.
And you can learn from small things, Trevor, in this way. For example, look at in Parliament. Before COVID, it was not known, even not only in Parliament, but people had not explored that you can meet using Zoom.
Yeah.
And now people still hold their meetings. Do you know, Trevor, to inform members of the public that if you look at global economic trends right now, the companies that gained most during COVID are online traders.
Yeah.
I mean, the shares for Amazon and eBay shot up. And immediately, Jeff Bezos was pronounced to be the richest man in the world. Quick in pursuit our other fellows in that kind of trade. And so what does that tell you? Why did China still record high economic growth after COVID? I mean, what is it that they've done differently? And so, we cannot continue to sell this story,
yeah,
that forward-looking and knowing that this is a virus that we are going to live with, that the best way is to continue to look for funds to pump into buying masks and asking people to stay at home,
yeah,
and not innovating. We have to think differently now. I would be challenging policymakers, I would be challenging government right now that we have to acknowledge, yeah, that to move our country forward, we must think differently. I saw the other day, I think it was on one of the shows on CNN, if you look at service that was being offered in one of the airports in Kigali, I think. They have robots there that you follow and so on, blah, blah, blah. What I'm trying to allude to is that you find that things are changing. If we want to support our people, we have to invest more in that ministry now called ICT. Yes. Ask Joe Musheru. Now that you know that this is the docket that you're sitting in, and this is how the world is going, sit down with the counterpart in the Ministry of Trade, yeah, and Commerce, and sit down with other arms of government, and ask yourself, how do we help our people now? Because they have to live, they have to do other things. And I think that is what a proactive leadership should be thinking about, okay, that the way to move now is not to just continue to lull and think that this thing will eventually just go away, yeah, and we'll go back to normal. Yeah. There's not going to be the normal that was before. Okay. We are going to have to live with this now. Okay. So can we help our people?
Dr. Mutua, what are your thoughts on this? That this is here with us now, so even these containment measures, we shouldn't really put all of them.
Well, the president has done well, and the government has done very well. Yeah. The national government, together with county governments, we've really managed to contain this problem. We went around, we got masks for our people, we got our people washing hands. As a result, actually, the statistics of death in my county and many counties shows that death is declining. We were being killed by a lot of tropical diseases because we are not washing our hands. Cleanliness, just basic hygiene. Yeah. People are healthier. Diseases like typhoid, diarrhea, they have gone down because people are healthier. But also, the reality is that we have not enforced what we have said we need to do. And I'll come back to this because our style of impunity is a problem. The WHO have said that if 75% of a population, not 100%, 75% of a population wore masks religiously for 1 month, you flatten the curve in that country. Just 75%, only 1 month. But in this country, you find there's curfew, but curfew only works in some areas in the big cities, like here in Nairobi, you'll find like where Citizen is located, the cops will be there. But go to Eastlands, go to Kawangware where I grew up, the bars are open until morning. Some belong to cops and others. So there's that sense of impunity whereby really we don't take this seriously, so it becomes a problem. I'm concerned. In Machakos right now, our ICU is full. Our HDU beds are filling up. Isolation wards, people have started going back into hospital. People are getting sick. People have started dying from COVID. I'm getting statistics every day. 2 months ago, the ICU had nobody with COVID in it. We were closing down the stadium's isolation ward because there was no person coming in sick. A few people here and there. We used to get 2 cases a day. Now the cases have increased. This thing is real and people are suffering. Yeah. I'm glad that the vaccine is here. People need to get the vaccine. The health workers get vaccine. We will get the vaccine when the time comes and the time is right because it will help. But it's only helping you individually. We don't have enough vaccine really to flatten the curve or get that hard, it's called the herd immunity going. Yeah. So for me, I'm coming back to this issue of, I know the economy is suffering, but this disease is the one that has made us suffer. What if we just tightened our belts and decided we are going to suffer for 1 month? Everybody wears a mask. Everybody stays home. You get out to do your work, you come home. There's strict curfew. If the police cannot work, bring the military. Let everybody adhere to the protocols for only 1 month. Let the government look for money to cushion families. Send money via M-Pesa to families. Send money to communities that are not able to lift up themselves. Feed people properly for 1 month. Yeah. And then we flatten the curve. We sort ourselves out. Then we open the economy. I mean, that's what they did in New Zealand. That's what they did in China. Yeah. That's what they did in the United Arab Emirates. The economies are booming because they decided for 1 month, whether you like it or not, unakaa nyumbani. Yeah. Whether you like it or not, utavaa mask. If you don't wear a mask, unakamatwa, you get into a problem. Whether you like it or not, you know what I mean? Yeah. We just need to be a country whereby the leadership at the national level decides that they have the power and the controls to enforce a sense of what you'd call emergency so that we can get back to focus because we are suffering economically. Okay. People are suffering, there's no money in the economy because of all these small measures. Yeah. Tumie kidogo, fungua economy, tutengeneze pesa. All right, I have to take a quick break. Cherargei, when I come back, we'll talk about this issue of drowning in debt, and I'll start with you because we are talking about the economy already. But for now, keep your views coming at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. I see some of them here. We'll be reading most of them when we come back in just a bit.